Hi guys, this is Eva from Bay Harbor Med Spa, and this is stage 2 of my video for women that are in menopause or getting into menopause. My previous video was talking generally about women that are in menopause or getting in menopause and what it is in general terms. And this video is going to talk about women, menopause, and their skin and how to treat their skin. But before I go any further and I go forward with this, I want to clarify something for all women of the world. Ladies, menopause is something that's not temporary. Menopause means it's a stage of our life which will last till the day we die, till the day we pass on. It's a stage where you no longer produce eggs, where you no longer menstruate, and this is the next stage of our life. Now, why it's important to understand that menopause is not a temporary thing. Even those of you who think that if you, let's say, had hot flushes, right now the hot flushes are gone, where you are past menopause. And I hear it so often, even people that I would think that really know one or two things in their life and are intelligent, which are lawyers, people who are intelligent, and they tell me, oh, well, I don't do this anymore because I am not in menopause anymore. Yes, everybody is in menopause, and you stay in menopause till the day you die. Menopause simply means past the menstruation period of our life. That's basically in layman language what it means. So if it's past, you're not going to menstruate at 70, you will never menstruate again. That means it's forever. It's for till the end of our life, which can be another 50, 60 years. Now, it's not all gloom and doom because menopause is here. However, we as women have to be smart about this, and we as women have to know our bodies and have to know what menopause does to us. And so because it's just part of life, I don't know why, but that's just how it is that when we get into menopause, our bodies change. Not necessarily for the better. The only good thing that I can tell women, and those of you out there who know that what I am saying is true will agree with me. Women who take bioidentical hormone replacement therapy, which means that they are hormonally balanced in their body and they have good nutrition, they exercise, they get good supplements, those women bring their sex drive back up. And this is the only time in your life, and it can be for the coming 30 years, where you no longer have to worry about birth control, about IUDs, about getting pregnant, because that will never happen. And so as far as I'm concerned, I don't want to be vulgar, but I will tell you that you can have the best sex in your life because you no longer have to worry about anything. And since, in my opinion, majority of men are very selfish, and majority of men, as far as I know, will not take a birth control pills or will not take anything that will make sure that the woman doesn't get pregnant during the time that the woman can get pregnant. This is now our time, El Dorado time. So if you choose like it, if you want to have sex, if you have a partner, whatever it is, if you don't have a partner, if you want to have sex with yourself, whatever it is, you can have as much sex and can be very happy and never have to worry about getting pregnant because that will never happen. If that happens, you will be the first woman on the universe that gets pregnant without having her period, without having active eggs. Said that, I'm going now into the part of our skin. And so as I said in my previous video that things change, and because we lack so many hormones, hormones are responsible, and it's like a network. for so many things in our body. And amongst things that we lose, but we can replenish it, is memory. It has an effect on our brain. It has an effect on our bones. It has effect on our skin. Our skin becomes extremely dry for a lot of us because we no longer have these stimulants in our body that help us to produce more or the same sebum oil stimulates collagen and elastin. So what are we supposed to do? Well, it's a two-way approach. Again, my personal preference and my personal suggestion is, if you have the ability, it becomes more and more mainstream. You find a doctor who specializes in bioidentical hormone replacement therapy. What that means is bioidentical, it's identical to your body. They do blood work, you get that done, and you get a cream, and you apply that cream. Those are the hormones that you are missing, and it balances your body. However, said that will not replace everything that you lost since you went into menopause, and it will not make your skin moist. So what is a woman to do, like myself, like you, that is in menopause, the skin is dry, extremely dry? What are you to do? So there are several things that I will suggest. It's a dual approach. It's an internal and external approach. I will speak for myself. I would say that I would suggest to every menopausal woman to seek either a nutritionist or research on the internet, but to start taking supplements, to start taking a lot of supplements such as omega-3 fish oils, antioxidants, a lot of nutritional supplements that will help internally the body, that will sort of all the parts of our body, and that will help our brain. Our brain is in dire need of oil, a particular oil, and fish oil, omega-3, omega-6 are very, very good for our brain, for our bones, for everything, for our heart. So taking internally supplements is very important. And now we come to the external part. What do we do on the external part? Now, because we no longer produce the collagen, we no longer have as much oil in reserves, our skin is very dry, we have to help it from the outside. How do you do it when you're at home and you don't have Eva like this next to you and you cannot come and see Eva? Well, I'll tell you what, I devised a system for people, for women, for menopausal women, that they can purchase from me, that will help them as long as you make the whole package work together. I'm not talking about what I'm selling you, but doing the bioidentical hormone, doing the internal, taking supplements, exercising, drinking water, and adding treatment for your skin, then it will be a win-win situation. What am I talking about? So two things. I will divide it into two categories. One, that we want to exfoliate the skin which is on the surface, which is very dry and it's flaky. Two, that we want to be able to penetrate and put into the skin as much moisture, as much as possible ingredients, serums, oils that will stay under the skin, that will give us that a supple, moist look. And I have it. I made it. I didn't make it for you. I made it for me in the first place. I was doing and researching until I found something that works for me. And because a woman that is in menopause stage of life is very different than a younger woman, not every product can work. And because not all products, or most of them, are not absorbed in our skin if we don't exfoliate, if we don't remove the skin. Now, so I will now tell you what I suggest that you do. And this, as I said before, it breaks into two. One is you exfoliate, one is you peel, the other one is you make sure that you put as much into the skin. How do you do it? Well, there's, for the exfoliation, for the peeling, there are two items, there are two products. There's microdermabrasion scrub, and there is mandelic acid. These are the two things that I suggest that you guys purchase. And then comes the other 2 or 3 things that I suggest that you purchase to start treating your skin as a whole, not only your face, your whole body, because everybody that is in menopause knows that everything dries out. And you want to replenish externally as much as you can. So what I do and what I suggest to you is you get a microdermabrasion scrub. These are crystals. And what you do with it, twice a week, you take a little bit, and I will show you basically how little, okay? So I want to be careful. Here is a spoon. Do you see? It's very little. You take this much, and you apply it on you take it into your hand, and you put it all over your face, all over your chest, all over your arms. So if you do your arms, obviously you will take more. What I just showed you, this is what you would take when you do your face. I suggest that you shower first, make your face wet. In the shower, you take a little bit of the microdermabrasion and scrub your whole face. You take a little bit more and scrub your arms, your chest, your legs. After this, when you step out from the shower, you rinse all this off. This is what I want you to do, and I'm going to show you. There are 3 items. These are micro needle rollers, and as you can see, I have them in 3 sizes, and I will explain you why. What I want you to do is, I want you to get a micro needle roller for your face, which would be this one. This one would be for your face. I want you to get a micro needle roller for your eyes, which would be this one. And I want you to get a micro needle roller for your body, which would be this one. What is a micro needle roller? A micro needle roller is a roller that, for instance, the one for the body has 1,080 little needles. These are the calibrated needles. And what these needles do, you take the roller and you go back and forth, up and down in every direction, and these needles create tiny micro channels. So this one you use is for your body. That means your arms, your body, your buttocks, your legs. This one you use on your face. So you do it everywhere on your face, and you do it for about a minute, 40 seconds. You go in every possible direction with this, and this creates little micro channels into the skin, hundreds and hundreds of them. And then you take this one, which is for the eye, and you will go under the eye and on the side of the eye and above the eye, and you will create little micro channels on your skin. What this will achieve is, if you would look under a microscope, you would see that there are tiny holes, hundreds, thousands of tiny holes when you did this, that are now ready to absorb whatever you give it. And what is it that you are supposed to give it after you do this treatment? There are 2 things. There is a serum, which is the HC serum. The HC serum is made out of hyaluronic acid and vitamin C, but it's a special vitamin C that will not oxidize. The vitamin C helps to regenerate some cells, bind them, and also helps to lighten some discoloration on the skin, which most of us have. Hyaluronic acid is in a gel form, and hyaluronic acid is not an acid as it sounds, as a bad acid. It's actually a component that is able to hold over 200 times its weight in water. So you abraded the skin, you created little holes, you are applying this hyaluronic acid with C onto your skin. You take a little bit, like 3-4 drops, you put it all over your face, This product, this serum, penetrates now into the skin much easier because the skin is ready to absorb it. It's not flaky, it's not dry, it's absorbing it. So you have this that penetrates in. This hyaluronic acid will stay for 8 hours under your skin, and it will hold moisture and water in under your skin, so it will give you a smooth appearance. It sort of like puffs up the skin. And after you put this, and remember, this is not a moisturizer, this is an ingredient, it's a carrier, hyaluronic acid that goes underneath with the vitamin C in it. And then you will take the microneedling serum. That is a serum that I made from several amazing different oils that I mix together, and you take 2-3 drops and you put it all over your face, your neck, your chest, wherever you did the microneedling treatment. That's what you put on, and voila, and you let it absorb. Ladies, I promise you, it's a given that you do this, and within a week, if you repeat this 3 times a week with the microneedling rollers, you will see an improvement on your skin. Within a week, you will see that there is an improvement. The skin looks better. And just quickly, to those of you who think, oh, but what kind of acid? Hyaluronic acid, by the way, in order for us all to move our joints, our fingers, our knuckles, we have to have something that allows us to move. We have to have a gel. That gel is hyaluronic acid. That's what we have between the knuckles. And many of you know that the older you get, your bones crack and crackle. They make noise because there is, and you have more pain because there is less hyaluronic acid in it. Well, that's what hyaluronic acid is. It's this gel component that lubricates and sits between joints and knuckles and bones and ligaments, and it allows us that movement. And as we get older, we get less and less and less of it, and that's also another component of the fact that we wrinkle. But if you use these basic products, microdermabrasion, microneedling rollers, hyaluronic acid with C, and the microneedling serum, you are on your way for a better, healthier, less wrinkled, more useful, more plump skin. And you do this for the rest of your life. You don't stop, because as I said, menopause is not a partial thing. Menopause is here to stay and will go with you till the end of days. So I hope I gave you some tips, some explanation. And until next time, guys, thank you. Bye, Eva.